Hi, Mr. Doe. My name is Lisa. I'm the nurse today that's going to be taking care of your baby. He looks great. Congratulations, by the way. I know he's been brought over here and weighed and measured, but I'm going to be doing a full assessment on him and we'll check him out. Is that all right? Great. I also have a student nurse with me. Her name is Jade. She's in her second year of nursing. I would love to let her observe me doing an assessment so she could learn. Would that be okay with you? Yes? Okay, wonderful. Come on in, Jay. Yeah, you might come in and stand right over there. You can see. And Mr. Doe, you can sit right over there. Ask any questions as you would like. Okay? All right, great. Let me put some gloves on here. Your little guy is nice and quiet. He's pretty content. Okay, first of all, let's check his ID band. Baby boy Doe, 1234 is his number. Let me check your number. 1234, Doe. Okay, perfect. Okay, Jay, this is kind of how I do things. I come on in here and do an assessment. Usually I get a set of vitals right away first. So because he's under the warmer, kind of makes it easy. I try to do the quieter things first. So I can look at the monitor and get a good heart rate of 150. See that his respirations look like they're about 50 also. He's saturating 98%, which is fabulous. But I'm going to listen to him at some point too and listen to make sure that that is an accurate number up there. So first of all, what we'll do is we will get a temperature on him. Alrighty. We do axillary temperatures for the newborns. Okay. We'll just let that go. We do have him hooked up to the heater up there, and that tells his temperature in Celsius right now. So right now it's saying he's 36.8, which is perfect. That's right in the range we need it to be. Okay, his temperature is 36.9, and if you want to see that in Fahrenheit, you can hit that button there, and that's 98.4. So he's doing great. Babies have the same temperature that we have. Their heart rate is higher and their respiratory rate is higher also. But otherwise their temperature is generally the same. We'll get a blood pressure on him. We usually do one blood pressure a shift unless the baby has a problem, is in respiratory distress or any other significant problems. So we'll put that on. We'll hit this button up here and we'll get this. And in the meantime, I'm kind of looking at everything about him while he's nice and quiet. So as soon as I'm done with the blood pressure, I'll tell you all that information that I'm looking at. Okay, wonderful. We got 64 over 42 with the 55 mean, so he's doing fine. Put that in there. Put that there. Another thing to look at as a vital sign is pain. Are they having any pain? Right now he's quiet. He's almost sleeping even through my talking. So we always medicate babies with sugar water if they're having any pain. But right now he looks to be doing great. Quiet, not having any problems. So I'm not going to give him any sugar water or a pacifier. So I'm going to look at his skin right now. I'm going to look at his color. Is he pink? Does he have any birthmarks? And as I move him around, I'm also going to be checking for more birthmarks. And we'll kind of turn him all the way over and look real good. Is he mottled, or does he have any acrocyanosis, which is blue hands and blue feet, which can be common in newborns? He's 2 hours old, so he could have that. Another thing we look for is circumoral cyanosis, which is blue around the lips, but usually his saturations would be lower and signify that, and I don't see any of that. We also look for jaundice, which is a yellowness, and being that he's 2 hours old, he probably won't show any jaundice, but on a baby that's 24 hours old, you might certainly see that. I'm looking at the peeling of his skin and any lanugo. Peeling is just typical peeling, and usually that signifies that they're overdue. And lanugo is the hair that they have. They kind of have that downy hair on them. And I don't see any of that. He looks good. He's got hair. We can look at their breast size and creases on the bottom of the feet to see if they are overdue or premature. And being that he's a 34-weeker, he's not going to have all the creases on the bottom of his feet. And his nipples might not be real protruding. On a more term baby that's 40 weeks, they will be larger. He looks appropriate. For 34 weeks, he is small. We've diagnosed him with being small for gestational age, which means he's less than the 10th percentile. So he is kind of small, but he seems to be doing well. So then we're going to look at how he responds, which he responds appropriately. He moves around as I do an assessment. I want him to do that. I want him to know what's going on. And he's moving all of his extremities well. That's another good thing that we want to see. I don't notice any jitteriness. Babies that have low blood sugar tend to get real jittery, and we see that, and then we might need to get a blood sugar. But he looks pretty good. I don't see that. We're also going to check his head. We check their fontanelle just by rubbing over it, and I'm going to see that it's flat, and it is. I want to make sure it's not bulging or sunken. Bulging can be a neurological problem, and sunken can be some dehydration. The other thing I'm looking at is his head. Does he have any molding or caput or even a cephalohematoma? These are things that happen when babies are born and they sit in the birth canal too much. He has none of that. So I'm going to look at his eyes. The distance apart of his eyes look appropriate. His ears, you want to make sure that his ears aren't real low set. If you take an angle of the eyes and go right down, that angle should be right on his ear. Sometimes you'll take that angle and the ear will be real low. That can be signify some type of genetic issue, but I don't see that at all. And I don't see any drainage in his eyes. His nose looks great. I don't see anything there. In his mouth, sometimes you can't get him to open, but it looks like he's allowing me to. I'm going to look to see if there's any natal teeth. Sometimes babies are actually born with teeth. Believe it or not, they fall out. There's no worries. And there's also something called an Epstein pearl, which is like a cyst, and that goes away too. And we always put a finger in their mouth to feel in the back to see if there's like a cleft in the palate. And I actually think I feel something. So what I'm feeling is I'm trying to see that it goes back all the way back and that it's complete, but I'm feeling like an opening. So I'm like my finger goes up. So what I'm going to do is grab the flashlight, and can you see in there? Mr. Doe, do you want to come look? There is a cleft back there in his hard palate. So that will be something that we'll have the doctor look at also. And to truly diagnose, we'll keep an eye on that. Right now he seems to be doing fine with that. If that's truly the case, that can be surgically corrected, but we'll let you talk to the doctor about that. I'm going to move my way down and go to respiratory. So because I want to listen to his lungs, I'm now going to also listen to his heart rate. And I'm going to listen for a full minute, okay? So I'm going to listen to his heart for a full minute. Okay, so I listened for 1 full minute, and I got his heart rate at 148. On the monitor, it's showing 150, so we're right on. And then the other thing I'm going to do is I'm going to listen to his lung sounds, and I'm going to count his respirations for a minute. So I'm going to do that now. Okay, I listened for 1 full minute, and I got 48 on his respirations. I'm going to listen to the rest of his lung sounds. I'm hoping he's clear without crackles or any type of other noises in his lungs. We don't usually hear a lot of wheezing, but sometimes we hear some crackles, like they have fluid in their lungs, and sometimes they can be diminished, especially down on the bases. Everything sounds nice and clear. I don't hear any diminished sounds. And then I'm going to listen to his heart with this side of the bell to see if there's a murmur. Sometimes listening to a murmur takes some experience. You need to hear a few before you really understand them. Okay, wonderful. I don't hear any murmur. Another thing, since I'm listening, is to listen. I'm kind of jumping, but to his bowel sounds. And he's got very active bowel sounds. If you don't hear any, you want to listen for a good minute, but I hear some. Wonderful. Okay, so going back to respiratory, I want to see if he's using any accessory muscles. So are his ribs going in when he breathes, or is he making a grunting sound? He would make the grunting sound kind of like a and his his nose, he would be flaring. So flaring, grunting, and retractions. They can be subcostal, intercostal, tracheal. All of those signifies they're pulling to breathe. They're having a hard time getting that air in. Usually when they have those type of muscles that they're using, their saturations decrease a little bit also. But his saturations are good, and he's not using any of those muscles. He's also not breathing fast. He's not tachypnic, which would be over 60, and he's not real slow. Standardly, like I said, 40 to 60 is an average respiratory rate.